Who do we have on the phone right now?
We have Dr. Guyron. I hope I pronounced it. If I pronounced it wrong, forgive me.
I believe that's right. Doc, good morning.
Good morning.
How are you?
I'm fine. How are you?
Is it Bauman? Is that the first name?
That's correct, yes.
That's close enough for it? Okay, Doc, there's a study out that we came across about studying twins. You're a plastic surgeon, is that right?
That is correct.
And you're at Case Western Reserve University here in Cleveland?
Yes.
So you did a study with the twins at Twinsburg Day, and a lot of people, 186 pair of identical twins, to try to find out about aging and how we age differently, and came up with some rather surprising results, I guess, right?
We did, yes. We wanted to see what are the environmental factors that influence the aging. Obviously, the twins are genetically programmed to age exactly alike, and if there's a difference in aging, it had to be environmental factors, and we found that some of the things that we knew were definitely factors, and we put some science behind those thoughts, meaning sun exposure, heavy drinking, and smoking. Those were the three known factors. But we also discovered that if you gain weight before age 40, you're going to age faster. Or if you lose weight significantly after age 40, it will accelerate the aging. So it is wiser and better to have a normal weight after age 40, or perhaps a slightly heavier, higher weight would be better. But we're not advocating gaining a lot of weight beyond what is healthy.
You know, it's interesting. I've seen people who have been heavy and lost weight, and after 40 years old, they were older, they lost weight and slimmed down, and it almost gave them a gaunt look. It almost gave them a slightly...
like they were sick or something.
Yeah, and they'd lost weight and they were thinner, and I'm sure felt better about themselves, but in many ways, they kind of looked sickly.
That's exactly what happens. The face becomes depleted, and the depleted appearance is not really good for the face. It's going to look the face to look more aged.
Now, the heart might look a whole lot better or something else, but the face
does look a little bit different.
So, Doctor, if I understand what you're saying, if you had a set of identical twins, if they ate the same and lived in the same environment, they would age exactly the same.
Exactly.
All right. So this would, because of these differences, you had to fill out 100. How many questions did they have to answer? I forget. It was a detailed questionnaire, I know.
Oh, it was about 3 pages questionnaire, and we also found some other fascinating piece of information. For example, if you get a divorce, there's a chance that you're going to be aging. There's a better chance you're going to be aging faster.
Got that right.
They will look older, and perhaps that has to do with the stress that has led to the divorce and during the divorce. Obviously, people who do not have a enjoyable life during the marriage, they're going to be aging faster. Those who were on antidepressants looked older. We do have some explanation. Perhaps it is relaxation of the facial muscles that fight the gravity effect on the face that causes a little bit more aged appearance. And also, those individuals who were on hormone treatment, ladies, these were all about ladies. We're going to be doing studies on the male patients as well, individuals as well. So ladies who were on hormone treatment also did not age as fast. So hormones have a beneficial effect. On the other hand, there are some side effects from hormones that they have to be considered by a physician prior to their use. So it has to be under surveillance of a physician if somebody is going to be on a hormone treatment.
What I found interesting, you say people who got divorced looked older, yet widows looked younger, if I remember correctly.
That is correct, yeah. And then also those who were single also looked younger.
Except for the ones who killed their partner. They looked a little bit older, I think. You know, it's a brilliant study. It really is, Doc, to come up with the idea of taking those two and comparing them. What about sex? If one twin had more sex than the other, did you ever get into that or look into that at all?
No, we did not ask that question.
Well, I mean, a sex life, a healthy sex life adds to all kinds of peace of mind and things that go into to life. Sex is a very important part of your life. I just wondered if one was, a lot more active than the other, if that had any effect at all.
Well, you know that we're not going to get an answer to a question like that. So.
They're not going to tell you, yes, I'm much more active than my sister or my brother or whatever. It is really a brilliant idea, though, to take a look at the two of them and see how they do. I would think cigarettes we would automatically say is a given. Alcohol is a given. Were there any things in there that you didn't expect it to come out that way?
Not really, but what we found also that you can have sun exposure, but as long as you protect your skin, you have those who use sunscreen lotion still looked younger than the ones that did not use sunscreen lotion. So obviously you can be outdoors and you protect your skin and you will look good. The other aspect that was fascinating, for each 10 years of smoking, the individual looked about 2.5 years older. So, for example, 40 years of smoking is going to result in looking 10 years older than otherwise the individual will look.
Okay, this is one that you can probably answer because you are a doctor. If one of the twins had had a facelift, did that twin look younger than the other one?
Well, we did not actually include those who had any type of surgery that could possibly alter our judgment.
I thought maybe you had worked that one in there somewhere.
You would hope so, though.
Yeah.
If they're going to spend money at the time in the recovery, they should look younger.
Yeah, well, I think so.
The other part that actually is important for the audience to hear about is, obviously, gaining weight is not good, but we can actually emulate gaining weight by injecting fillers on the face, which is, again, we're putting science behind what we have been doing for a while. Fat injection or Restylane or other materials that we inject the face, it is exactly doing what gaining weight would do without the health hazards. So I think that's...
Are you talking about Botox, something like that?
But not Botox. Botox actually is not a filler. They're injectables are a person's own fat.
Okay.
Or we have also products that we inject in the face, like Restylane, which is hyaluronic acid that we inject in the face to eliminate the fine lines and thicken the skin. And that's exactly what we're doing. We're restoring volume to the face that has been lost as a result of aging. So gaining weight is not the answer. The right answer is to get some volume restored to the face.
Yeah, so it goes back to that gaunt look of looking sickly when you lose weight, and you've got that look on your face. So fill it up with some filler, and you're going to be better off.
That's correct.
Okay. Are you an active plastic surgeon right now, Doc?
Yes, and I run the Department of Plastic Surgery at Case Western Reserve University.
All right. We talked about this a little bit from the study here, but that particular work right now has come down because of the economy. It's been suffering. People don't have the extra money to go in and get the implants or the facelift that they did before. I would assume that has cut back on that a great deal.
But it has cut back on the surgery, but people still look like would like to look better. Therefore, they're using the injectables or less invasive techniques to achieve their goals and temporize the surgery, delay the surgery until the economy changes.
Now, Doctor, does that stuff go on sale then? Do you have... I'm serious. If you're in a slump there, do you have sales on plastic surgery?
Well, we do. I'm sorry, there were two questions at the same time. I didn't hear the second one, but let me answer the first one. Well, there's no sales in plastic surgery, but we do consider the economy and we all of us have come to the conclusion that obviously we have to alter the way we charge.
Now, Doctor, last week we had a lady on. She invented the face bra, and she said that instead of having surgery, you would wrap your face with this bra and put minerals on your face, and it would be like a plastic surgery without the surgery. Have you heard about that?
No.
Okay.
It's equivalent to a body wrap. You know the body wraps that went around, Doc? It's the same thing.
Yeah. No,
those may work temporarily, but most likely the muscles are going, gravity is back to pull the tissues.
Doesn't the same thing happen, though, with the fillers? Don't they eventually dissolve, and you have to have it done again and again?
Well, we do have a variety of fillers. So if you use person's own fat and inject to the face, that is something that belongs to the face. The patient is not going to go away. There are also more lasting injectables than the ones that were in the market a while ago. Now we have intermediate lasting injectables. We have also essentially permanent injectables, which again is person's own fat.
Okay, so summarizing a little bit of what you found from having twins doing the same type of thing. If you drink, it's going to make you look older. If you smoke, it's going to add 2.5 years for every, 10 years?
Yes.
If you have if you don't use sunscreen, if you get a lot of sun, that's going to make you look older. And losing weight after 40 is going to make you look older.
Exactly, and gaining weight before age 40 is going to make you look older.
All right. Interesting look at the
hormones restore health to the skin, and don't get a divorce.
Okay.
Yeah, but won't stress make you look older?
Yeah, it will.
Stress does, yeah.
So, absolutely. So if you're getting a lot of stress, you put him into a catch-22, Doc. You need a divorce. You're under a great deal of stress. You're afraid to get a divorce. That'll make you look older. But if you keep staying there, the stress is going to make you look older. What do?
Yeah, well, but you find a way to work it out. There are marriage consultants that they can help you to resolve the issues and to take it easy with the life and not to be so upset about every matter that happens.
Good point.
This is a bad situation. You're over 40.
Yeah.
You're having your midlife crisis. So you're stressed out.
Yeah.
That's bad. You start thinking about getting a divorce so you can be with a younger woman. That's bad.
That's bad.
All the stress makes you lose weight. That's bad. It's just a bad situation.
You're right. Find somebody, stay with them, work it out, and have a good life, right?
Right.
All right, Doc, it's great to talk to you this morning. Really an interesting idea and a study, all from Twinsburg and from the identical twins that go to the Twinsburg Twins Days Festival. Thank you for talking to us.
Thank you.
Great
have
stuff.
a good day.
You too.